Hello, my name is Dr. Giles. I'm a doctor of chiropractic and a natural internist. And today I wanted to tell you about something that is literally could save your life. This is so important. It's a way that we can actually determine what's going on with your cardiovascular system and your autonomic nervous system. Cardiovascular, you understand that? That's heart and lungs and vessels. And the autonomic system is what happens to you automatically from your subconscious, from emotions, and from that system that runs everything from your heart rate to your thyroid function to your eyes dilating. All that is autonomic. So I want to show you this wonderful report that we get from what we call the Max Pulse. It's a neat scanner that will scan you cardiovascular system and the autonomic system. So I'm going to go over this report with you and show you what are the things that we can look for and how objective they are. It's amazing. As you look at the report, this upper part right here, this is the average heart rate, the pulse. This is the high pulse and the low pulse for giving you the average. So that's just at a resting heart rate. What does this patient look like? Next, we look at this report here, which is what type you are. The type represents your thickening of the arteries, how much plaque you have within your arteries. So a type 1, which is the, I don't know if you can see that right here, that shadow line is what a type 1 pulse or this is done off of an EKG off of your finger. So it's checking the contraction of your heart. There's so many other different things are shown here. But you can see where this is a shadow. That would be a type 1. This patient comes in at a type 4. So a type 4, usually when we're at type 1, we're measuring from here to here. So as this angle drops flatter and then ultimately heads down this way, down to a type 7. A type 7 would be almost completely full of plaque. So this is a demonstration of plaque. So a type 4 is not very good. We want to be up at a type 1. So the type 1 is here. Great way to determine if the patient has a lot of plaquing within their system. Next, the DPI represents the overall strength of the heart itself, the heart muscle in general. We want to see that these numbers end up being in the optimal range of 70 or greater. That's optimal. Normal would be 30 to 70, but that's kind of normal for the United States, which the number one reason for death in the United States is cardiovascular disease, plaquing of the arteries, and heart problems. So we want to see that this DPI and all of these 4 measurements would end up over here in the 70s. Eccentric contraction is the contraction of the left ventricle. The left ventricle is the side of the heart that contracts and pumps blood throughout the whole system. So we want to see that number again is 70 or above. Arterial elasticity is how much elasticness there is within the artery. How pliable is it? Is it full of calcium, or is it all plaqued off within the actual tissue of the artery? So we want to be able to see that, have elasticity. As the heart contracts, we want to see it open and shut, if you will, stretch. That's arterial elasticity. The next is residual blood volume. That's how much blood is left in the heart after it's contracted. We want to see that there is not as much blood. It's configured so that this will also give us 70 or above. So the overall wave type is a type 4. That's the flat here. So we want to see that move towards a type 1. And there's a wonderful supplement called Cardiar, which I'll explain now, is a combination of L-arginine and L-citrulline and other supplements that help build the heart muscle. So Cardiar, let me just stop. Let me run in the room next door real quick. I've got to get a slick of what Cardiar is. This is a great picture of what Cardiar does. If you look at this cross section of the artery, inside the center, these are epithelial cells that produce nitric oxide. NO is nitric oxide. Within these cells, now as they produce the nitric oxide, it's actually lining the arteries, making them to become smoother, almost like Teflon, smoother so that plaque and things can't build up. It also helps to create more elasticity of the artery. It drops the overall plaque. It helps to remove plaque. It also helps to drop the overall cholesterol in the system. So Cardiar is the 1998 Nobel Peace Prize winning for health. The concept of L-arginine and L-citrulline. L-arginine at 5,000 milligrams, L-citrulline at 1,000 milligrams. So a 5-to-1 ratio is what the research showed help to drop the plaquing out of the arteries. And this is what we're seeing. We've seen this over time, that as the patient takes this amount of arginine to citrulline, that it will drop that plaquing out of the arteries. It's an amazing process. So as we take the CardiR, we're going to expect to see this start to come back up to a 3, 4, or 3, 2, 1. And as we saw today with one of our other patients that has been working, her numbers are starting to resolve, and that's what we expect to see. So that's a type 4 one, and move it to type 1. So this section here is cardiovascular. This section here is autonomic. Now, there are 3 basic ideas here. It'll show us, the scanner will show us how much physical stress the patient has, how much mental, and ultimately the stress resistance. So stress resistance would be their ability to handle stress, their adrenal glands, their thyroid, their ability to handle all the things coming at them. We want this number, the stress score, to be 50 or below. So as the stress resistance comes up, and we're able to work with some of their mental stress and help them through adjusting the vertebra and so forth, help drop their physical stress, you're going to see this kind of reverse itself to come like this. So there's going to be more stress resistance build up. So this is a tremendous way to see what their overall stress score is. Next, we're going to look at their power spectral density. This information comes as specifically associated with parasympathetic nervous system and sympathetic nervous system. These 2 bars here are associated with the autonomic nervous system. Sympathetic is the brake pedal, is the gas pedal. Parasympathetic is the brake. So if my eyes need to be dilated because I'm running from a bear, I'm going to be in sympathetic. My eyes are going to be dilated. I'm running, looking for the next tree to run up. Once I get up to the tree and I start to have my lunch, I want to shift into parasympathetic. So we want to see that these 2 numbers are able to move back and forth. Further, from the power spectral density, we're able to see high frequency, low frequency, very low frequency, and overall total power of the autonomic system. Each one of these represents an issue. For example, very low frequency represents temperature regulation and hormone regulation. So if they're down, these numbers should fit within these brackets. So if they're down, we can give them a supplement, a maca supplement, that helps to balance that system out as well. So each one of these represents a certain part of the autonomic system. Lastly, we look at the heart rate variability. This patient is quite low. There's not much change within the heart. As we're having the scan run, we're talking to the patient, explaining what's happening. So we should see an increase and a decrease in their heart rate. It should kind of elongate and slow down and so forth. When there's not appropriate balance in the autonomic system, it just flatlines. So you can see how this is just basically flat. Now, this is not the first of the same patient. These are 2 different patients. But I wanted to show you what it would look like if it were healthy. This patient is a significant racer. She rides cycles. So she street races and does long cycling. Or for example, that's a perfect type 1. 100% type 1. Where this patient had actually 88.5% were type 4. Others were type 5. This patient is 100% type 1. That means that during that 3-minute scan period, 100% of her contractions show this waveform. But as they start to become sick, you'll get some moving in, like she might have had 90%, or maybe 80% were type 1 and 20% type 2. So as it gets sicker, there's going to be more waves starting to go towards the type 7, if you will. And those are the ones that have plaque within them. But look here. Compared to DPI, this one's at 19. She's clear out here at 76%. And eccentric contraction of the left ventricle up here at 76. Arterial elasticity at 74. But interesting, she has 60 on the residual blood volume. I would think that she would have had a lot more because of how strong she was. But look at this. Physical stress, mental stress. Almost nothing. Stress resistance off the chart. It can happen very easily. So stress resistance increases with exercise as well, not just supplementation. Her spectral density analysis shows up, she's clear past here. Just a little bit of trouble here with hormone. I'm sure she's pushing when she rides her bike so much. Her hormones are probably decreased a bit. So we want to give her some maca, would help raise that up. But compare this heart rate variability So this heart rate variability, this one literally is just a flat line. This one's moving quite well. Her average heart rate, 47, with a high of 61, low of 41. So that's what we'd expect to see with someone that's as exercised as she is. This is tremendous, guys. I don't know if you can see, but we can actually find out where your problems are in your cardiovascular system and give you specifics to help you. And then recheck it in a couple of months and see progress. But we'd expect to see some major significant progress cardiovascularly with the Cardiar. Again, 5,000 arginine, 1,000 citrulline, and other things of other herbs to support heart overall. We can stop this. We can stop and reverse cardiovascular aging and plaquing. That's what the research shows. That's what we see. So that's a wonderful process for you. If you have questions, please feel free to call the office at the number below. We can answer questions for you. We can do the scan. I charge $50 for the scan, which is nothing, to find out this kind of information. So I hope that's been beneficial for you. If you're in the greater Salt Lake area, is where my practice is located, we can run a scan for you. If not, we can find out if there's someone in your area possibly that has a scanner such as this. If not, it's worth the flight to come here and get this checked. So I hope you have a great day. Until next time, see you.